Onc Live Insights is a video editorial program produced by Onc Live.
So also of interest is combining other agents to tyrosine kinase receptor inhibitors. There was a phase 1/2 study that was presented at ASCO 2015 in which patients received both imatinib combined with a MEK inhibitor known as binimetinib. This was a study that was seeking to determine if patients that were already refractory to imatinib could actually develop some level of efficacy by circumventing resistance induced by the MAP kinase pathway. Patients were essentially enrolled to this study with the primary goal of finding the recommended phase 2 dose. In this particular study, 9 patients were actually enrolled in the dose escalation phase, and then an additional 9 patients were treated once the recommended phase 2 dose was found. Patients that received the combination had a 33% CHOI partial response. By RECIST 1.1, approximately 50% of the patients had stable disease. Importantly, patients on this trial, on average, had approximately 3 previous lines of therapy. So, in understanding that these patients were already heavily pretreated, there was clearly some level of benefit. And thus, this particular combination is going to be studied in a larger scale fashion to determine if it may play a role in the treatment of patients that fail other lines of therapy. There are currently 2 combination immunotherapy studies in the phase 1 setting, in which one particular study is combining imatinib with ipilimumab, and there's a second study that is combining dasatinib with ipilimumab. Clearly, the goal for these studies is to determine a safe recommended phase 2 dose, but also is to determine if there's any level of efficacy for which this may become a consideration for patients in the future. There have been recent reports to suggest that GIST also have a high expression of certain biomarkers such as PD-L1. So in the future we may expect to see tyrosine kinase receptor inhibitors being combined with either anti-PD-1 or anti-PD-L1 based strategies.